Hello everyone. So today we'll be discussing on slipped capitofemoral epiphysis. Okay. So this is our topic for today. So our topic is SCFE, SCFE. So why is it important for us to understand SCFE? So this is on the basis of your orthopedics, okay? Orthopedics. And why is it important to understand SCFE? So we have two important component under pediatric orthopedics. One is developmental dysplasia of hip, other one being SCFE. Whenever we talk about SCFEs are much more common to see due to the faulty carrying seen in DDH. Okay, due to the faulty carrying seen in DDH are more common to Caucasians, or it is also common to fair people. We know the mnemonics for DDH, that is F's. Okay, like we have remembered with female, then you have firstborn, then you have frank breech, and then you have fair. So fair means Caucasians, right? So these are the important risk factors for having DDH. So what was the risk factor for having SCFE? So why is there even SCFE? See, SCFE, I will just first of all I will just talk with you with this video lesson, and then I will go with the writing part. Okay, so understand SCFE with a concept. Okay, SCFE, it's more common to pubertal age group. So why is it common to the pubertal age group is important. See, SCFE is there because of the excess of your growth hormone but lowering the values of your sex hormone. So write it down with me here. So if you have a growth hormone spurt, okay, so if the growth hormone is in excess and your sex hormone is low, what happens? Basically your growth plate, it increases in the length, okay, but it does not have that tensile strength. That is why it tends to break through the hypertrophic layer of your growth plate. So you know that the growth plate has GPHCO, okay, GPHO, I think, germinal proliferative hypertrophic calcification and ossification. So these are the different layers that you have in the epiphyseal plate, isn't it? So if in case the epiphyseal plate, it grows in height, okay, it grows in height, but it does not have that tensile strength. If it does not have that tensile strength, it will ultimately land to a fracture in the hypertrophic layer of the growth plate, and that is known as slipped capitofemoral epiphysis. I hope you are clear till here. Now I would like you to understand that SCFE is more common to either Western population, or is it common to the Indian population or Indian Southeast Asian population? So yes, SCFE is common to the Southeast Asian population, but whereas DDH is common to the fair person. But these both questions are very important in your university examination as well as for your PG MCQ. Okay, so I'll try to cover the things that is important for you. And understand, whenever we talk about slipped capitofemoral epiphysis, we think that the femoral epiphysis has slipped from its place, right? But actually, slipped capitofemoral epiphysis is a misnomer. And why is this misnomer so important for us? Because understand this well, this concept well. Suppose this is your pelvis, okay? This is your pelvis, and you have your, this is your femur. Now what happens is your growth plate is over here, right? So whenever there's a fracture, so let me show fracture with a white color. Whenever there is a fracture in this growth plate, what happens is the above this epiphysis will stay inside the acetabulum. Suppose this is your acetabulum and this is your okay, this is your head of the femur. Suppose there is a fracture over here. Suppose that there's a fracture over here. Then this part is being pulled by the muscle. There's a muscle being attached over here, and this part is pulled by the muscle, but the head of the femur will be inside here. Okay, it will be inside here. So it depends. So SCFE is a misnomer. Do not think that the epiphysis will be slipped. Okay, it's just the shaft of the femur as well as the neck which is being pulled. So this pull is towards the superior aspect. Okay, this pull is towards the superior aspect. Okay, so you need to understand this very important concept. Now next, let's talk about the next concept that is important. So I told you a person who is having an excess amount of growth hormone but a low amount of sex hormones. So what will be the person present with? Of course, the person will present with a puberty. Okay, suppose a person who is having a person at puberty, understand this concept very well. A person at puberty will have an increase in the growth hormone but decrease in the sex hormone. That is why the strength, the potential strength of the growth plate is not maintained. That is why there will be fracture, isn't it? So what will be the other features? So yes, of course, he has low amount of sex hormones. So I told he, first clue, this is more common to males, whereas DDH was more common to females. Okay, he had less amount of sex hormones, so he will come to the department of orthopedics. You can see that, and when you go for an examination, from top to bottom examination, you will see that this person might have gynecomastia. You might see that this person, this child, will have micropenis. So these are the different other associated factors. And when you order a thyroid profile, he might have a hypothyroidism, right? So certain endocrinopathies, it might be a hyperprolactinemia. Okay, gynecomastia associated with hyperprolactinemia. So these are the different features that is associated with SCFE. So just correlate with the things. One, pathogenesis, the etiology is in your mind. Okay, what was the etiology? The etiology was there is more amount of growth hormone, but the sex hormone is less. Okay, so that was all about your etiology. Now you need to understand that overweight child, obese child, and of course obese males. Okay, now you go for a diagnosis. How would you go for a diagnosis? So there is something which is known as Threatovan's line. Okay, Threatovan's sign, Threatovan's, Throwan apostrophe S. Okay, okay, Threatovan's sign. So what is the Threatovan's sign? So understand this concept also very well. See, Threatovan's sign means particularly if you have this is your so you'll actually take both hip picture. Okay, x-ray. Suppose this is your one portion, and this is your head, neck. Okay, femur like this. This diagram is very pathetic, I know that. So what we'll do is, from the superior border of your neck, okay, you'll just draw a line. Okay, from the superior border of the neck. At normal circumstance, this is known as Klein's line, Klein apostrophe S, Klein's line. From the superior border of your neck, if you draw a line, if you draw a straight line, that line, it cuts the epiphysis on normal circumstances. If it doesn't cut the epiphysis in this way, suppose you look into this this diagram towards the left side, in the left one. So if it doesn't cut towards the, doesn't cut your epiphysis, if this is cutting your epiphysis, this is normal. This is not cutting your epiphysis, this is abnormal. Okay, see here, I'm showing you that in the left hip, right? From the left hip, you understand that left hip is much more common than the right hip. Okay, and one more thing, one more important thing that I want to add upon here is how with the patient's limb. So the patient's hip will go into coxa, and he will present with difficulty in internal rotation and abduction. Difficulty in internal rotation and abduction. Okay, so how are you going to treat this patient? So for the treatment purpose, you will use certain pins and then you stabilize it. Sometimes even close reduction, just that suppose this has slipped, you'll just put this into place and then you'll just put a POP. That might actually help out. That might actually help out you to maintain that integrity. But if in case, okay, if in case that doesn't work, you have to go for Austin Moore's pin. Okay, Austin Moore pin. So I'll continue more on the management of this video, management of the SCFE in the next video. Thank you for now.